Good afternoon. This is Dr. Bill Wyatt again, and I'm going to talk a little while this afternoon on the use of elastics in orthodontics. But elastics is a source of getting force and putting force on teeth that move teeth. If you get an imbalance of force on a tooth, it is more over here than it is on the other side, the tooth will move in the direction that the force is pushing it. Now, it can fool you sometimes. You be on the outside and pushing on it, and the tooth will spin like that as it moves. You're pushing on the side. You're thinking about the center of the tooth. You have to think, if you're going to push it to get it to go straight, you'd almost have to push on both sides at the same time, and it will go straight over. Otherwise, it's going to tend a little. Sometimes you can let it roll a little and then straighten it out with the arch wire later on. But let's just talk about some of the things that you can do to get force to move these teeth. Now, I like to use natural forces as much as I can, like the way somebody swallows. If they swallow correctly, they bite their teeth together and press down. If you put something between the teeth, like these blocks of acrylic or something, you will bite more than you do normally, and that gets the muscle force along with the elastic force and do just tremendous things to the teeth. You can move the whole group of teeth over, and the teeth tend to carry their bone structure with them as they go. They don't just come out of the bone unless you pull on these three here and pull them one way and pull the other one. Then you could pull this one through the bone structure if you wanted to. But if you're taking a group of them and you just go with a normal speed, you'll move the teeth out, and the bone structure will go right with the teeth, and the teeth will stay vital and everything. So you can widen the mouth on anybody that's alive. It doesn't matter. You can put enough, just some force that will gradually expand it. Now, people thought, well, you can't put a tooth where there is no bone. Well, that's not true. You can put your front teeth out here, and there's no bone out here. Kids do it all the time. Just put your thumb or your musical instrument in here and put a little weight like this, and you'll bring the teeth out. You don't move the teeth out of the bone. The bone goes with the teeth. Now, and that goes as far as I had a 40-something-year-old man that came in and said, all his life, his teeth were right here. But then now, he comes in and his front teeth are sticking out here. Said, how can this happen? And I talked to him for a long time. And finally, after I left the room, he told his assistant that was there with him, says, I've been sucking or putting these lozenges up in the roof of my mouth to stop smoking, and holding them there with my tongue, just pushing on them. And this pressure alone moved this 40-year-old man's teeth out just like a kid sucking a thumb. So what we're looking for is something that all the forces that are exerted on teeth, a lot of times you don't realize, what you have sources of force on teeth that you don't know about it. For years I wondered why bicuspids and things like this would be sucked in, be pushed in here. There was no way I could do the muscles to make them push them in like that. Well, I woke up one night and had a tremendous vacuum in my mouth. If you form a good seal and you swallow 2 or 3 times, you'll create a negative pressure in your mouth, and the vacuum will push your cheeks. The cuspids were strong and they didn't go in much, so that steel went around and kind of like that. And it's pushing the bicuspids, which are weaker in. Now this is not elastic force, but this is the use of force. So let's take this young man, and I'm going to talk about the forces that are working on him and kind of add to that some. Let me get this little arrow right here so I can draw on it as we go. All right, here's a young man who is fairly full in the face. Now, this again, in other words, his face is like that. Some people would want it more this way. Some people even want it in. I do it like the person wants it, and like their parents and people. And if they're used to that, and that's in the family, and they have a full face, then they can keep all their teeth. You can make them as full as they want to in there. So let's just look at this. But this young man has a crowded set of teeth. He's got a lot of crowding in there, and that indicates that somewhere in his history, one parent had a broad face and big teeth, and the other one had a narrow face and smaller teeth to fit them. And you mix the two together, and you're going to get somebody with the big teeth a lot of times with the narrow face, and you can't put all their teeth in there without blowing the teeth up like that. So it's so silly talking about extracted or non-extracted. If you want to make it look good, you've got to have a normal amount of pressure in there and force and fill this out. But it's however the patient wants it. Now let's get back on the elastics here. All right, looking at him from the front, the vertical height of the face is pretty good. We just kind of measure the face off up to like that, maybe a little extra down here and then up around the forehead like that. Divide the face up good. Now if you give too much too much height in this and run the face down like that, you got the person stretching their mouth out, and it does not look it. It doesn't look good at all. Then you can mess up a nice face if you increase the vertical height of the lower third of the face, and that can be done pretty easily. Now this case was done back in 1970 something, and back then we used nothing but bands. We didn't have any brackets, anything. The bond material wasn't good. Now we used a lot of headgear to do certain things, and that's just a way of getting force. Now you see this thing right here, that's an elastic that's going around the neck of the person. So we call that a cervical headgear. You can make an occipital headgear where you come off of the occipital bone up here with elastic, and that's elastic force, pulling on those teeth in different ways. Now, a lot of this sounds ridiculous, but I went to a lecture one time, of a guy who speaks all around the country, and he was talking about how you could push teeth back on one side of the mouth and not do it on the other side. It wouldn't have any pressure over there. It says I would just put more force. In other words, I'd pull over here with 15 ounces of force, and I'd pull on this side with 10 ounces and move the teeth to one side. And I didn't say anything, but I just kind of laughed to myself. I said, how on earth are you going to do that unless you screwed something in the back of the neck back here to do that? This force, if you pull from here and here, it's going to be equal. It doesn't matter who you are or how educated you are, but this guy didn't have enough education to know about the force in there. Now you can put force You can put more force on one side than you can the other side if you want to. You can put 15 ounces over here and 10 over here. But what you do if you want to have imbalanced force, I want to push this side of the mouth back more than this side, then you take this arm right here and go out somewhere like this. And this arm over here, you stay just as close to the face as you can. Now this distance from here to here, and you put a force on it, the force is going to be the same here as it is here. Now, so you go to the center of this, measure the center of this part right here, and the center of this. If these are the same distance in there, that's where the movement is going to be. So you can put a greater force on one side of the mouth than the other side with the cervical headgear if you widen the hook out over here. But this is unusual. They will hook it in the pillow and everything. You can't do too much, but you can put some force in and slide the teeth around from one side to the other of the mouth with a cervical headgear. An occipital type headgear, you put a little pin in here that goes in and touches your braces, your arch wire, and you can bend these arches, make them short, and I can have the force. I'm pulling up like this, you see. So the occipital comes off like this, comes down over the face, and you pull from, and if you cut this bar back here and make your hook back here where the last teeth are, then, and you pull up on this, it will rear the arch up this way and pull, pick the back of it up. In other words, it picks the back up more when it's back here. If you cut this bar off right here and make your hook, you can elevate the front part of the mouth like that. So it's where you put the force, and that's in your using elastics to give you the force. And that's just one of the many, many ways that we use different elastic material to give us forces that we want. Now here is this young man's teeth. I mean, there's a bad Class 2 Division 1 with a deep bite, and it's got a overjet here about like, looks like it's about 12 millimeters. And he's fairly full at here. We want to bring this young man's face back in here like this. Now, if he's got wisdom teeth coming in, we want back here. All right. So in his case, they wanted the face back in. They didn't want the fullness of it. So we recommended taking out the first bicuspids on the case. Took them out. So we're going to move these teeth back in, and we may move these teeth forward some, you see, and bring it to a Class 1 relationship in here, and we're going to go down with the anterior teeth, which they're way up here. As we pull down on them, they're going to flare out this way. And these we'll have to pull back in. We're going to have to change the torque on them. They'll have to be going up and down like that. And the forces that we put in there are coming from elastics and also from tightening the wires up that we put in here. You have a double force on there. And we can use chain elastics. There's just all kinds of things you can do. You can virtually move the teeth anywhere you want, and you can move them on people that are, I think you can move them on 90-year-old people. I think my teeth move now, and I'm 93, and they would move too if I hooked them up. So this old bull of the bone getting so hard and all this people don't want to work on adults, and that's what irks me. I think orthodontics ought to be set up, and people do adult orthodontics as well as any kind of orthodontic. People want their teeth straight. Okay, we won't mark on that too much anymore. All right, so the other side of the mouth is off too, and so we're going to take out 4, and we'll have to get these teeth lined up. See, this is a crossbite right here. This is kind of a class 2 division 1 case, and I just carry it to the end. Now here the teeth are on the upper. You could put them in, but the teeth are sticking out further than we want them, and there's more of a narrow arch. We can bring these teeth back in by actually widening this arch. In other words, you can bring it out like that, and you can take somebody with what we call like a dog's mouth like this. If you spread it and broaden it out, you can actually broaden it, and it will bring the anterior part in. So if you don't want to take out any teeth, you can broaden them sometimes, and it'll reduce the profile from the front just from force that you would put on there by the arch wire. It would have some force in it too. All right, let's get on with elastics here. And here's the lower arch, and it's crowded too. He's got 2 bicuspids down under there. I'll show you the x-ray in just a minute. This is a cephalometric and showing you where the overjet, overbite and everything is in the airway. There's a lot of things you get from this. Now here is the first Panoramic we took on this guy in 1973. And this is the second bicuspid coming in here, and there's just not enough room there to get it in there. Same thing over here. You got a second and a first trying to go in here, and there won't be enough room. So we're planning to eliminate the bicuspids right in here and take them out. Now don't say you could do this without it, because you can. I can expand this enough and put all those teeth in there, and then I might have to extract this wisdom teeth. He's got, I don't see this one forming yet, but I see this one forming pretty good. He's probably got one up here. We take these bicuspids out. Sometimes it will make plenty of room here, and it's give this tooth about that much more space, and the wisdom teeth will come in the mouth. And we do this fairly often. If we extract the bias, we try to save the wisdom teeth back in the back of the mouth, and that works. Now this is on the old-time Panoramic, and you have to cut the thing in the center. It's something like maybe that's right there. All right, back to the force. Now, we used bands back then. We didn't have any brackets or anything like that. And somebody asked, I just got the email from someone saying their wife or somebody wanted to have bands put on her teeth. Is there any problem with it? Yes, there's a lot of problems with it. I mean, other than being about 2 or 3 times as much work putting the bands on there as it is putting the brackets on there. Well, you've got a layer of metal here and a layer of metal here. You've got a layer of cement under the metal, layer under here, and you've got that between every tooth you've got in your mouth, and you had to come in and put separators in between those teeth and make the mouth sore as dickens, expanding the teeth so you could get the bands on the teeth. And now you count every gap you got in there. You've got 2 layers of metal and 2 layers of cement, and you're going to have a lot more space in here, and you cannot guess at where the torque's going to be. Well, that's the benefit of brackets over bands, and there are a whole string of other benefits there. So we cover that while we cover force. It takes force to expand those teeth like that. All right. Now, this plane of rubber bands pulling the teeth around, and you can put class 2 elastics. Now, we used to solder hooks on here, like that, and it's still good. In other words, let me show you something about class 2 elastics. If you're up on orthodontics and everything, a class 2 elastic is in kind of a little box like this. Now, if I pull from here to here, I've got a vertical portion of stretch. It's a vertical. It's pulling the upper anterior down and pulling these up back here at the back that much. Now, if you reduce this rectangle and you make it come over like this, and you cut down like that, and you put the hook here, and you put over here, you reduce the vertical force that's in there, the amount that is dropping down or picking up back here in the back. If they choose, sometimes you have to, in something like hooking it up to the top makes a lot of difference. You put the hook down here and go up over here, and you come pull straight. So you have a lot of horizontal force and use a little vertical force as you possibly can, because these are coming down where you don't want them to, and these are going up, but the occlusion stops this, and you can put a curve in the wire that will tend to stop this from coming down, and if you put something here to increase the occlusal force, it won't let this go down either. So there's different ways of dealing with force in fixing the teeth. Now we get back over here, and these are brackets that are in between. We'll drop this down, so this will be pulling back, but we're going to the inside of it too. Now let me get to a place where we've got an elastic on the inside. Same thing over here. See, we go from the buckle or the up there close to the labial of the cuspid and go down to the lingual or the molar. Now, if the molars are tilted down here, I put lingual buttons. You have a band on the tooth like such, and on the measle of it we put a little button out on each side like that, and we hook the elastic to that, so that pulls it less. If we put it back here, then we spin the tooth in this direction too. So you have to think about all these forces mixed up. Where is that tooth going to go? What kind of force are you putting on it? What kind does a person add to it, like chewing a lot, or chewing their nails, or sucking their finger, sucking their lips, biting their lips, all sorts of forces that you don't really want in there. And the way people swallow, the way they breathe, puts force in there that messes up the occlusion. All right, now we go like that. And here we've extracted those teeth, and we're bringing this back, and I'm using up a lot of time here, going back into the second molars back here. And we want to line these cuspid up across here. This is on the bottom arch, and that's going to fit on the upper teeth. Will be like that, see. This groove will fit into the upper arch. When you chew, the cheek is held out by this upper buccal cusp up here holds the teeth out where you don't bite it. Now my lower arch is too wide and I bite my cheeks frequently. I know about that one, I just haven't done anything about it. Now you keep that edge going down all the way to the teeth. Now if this tooth is much thinner than the cuspid tooth over here, and we want to keep this in line, we have to sometimes make this bracket thicker underneath here. We'll bring it out a little bit, and this one thinner. It looks like they're lined up, but we don't have brackets in there. But that's what we're after when we come in here with it, is to keep this incisal edge. Now this tooth is turned this way. Now we use force. We've got a super way to rotate teeth now, and we put a hook or something on this tooth down in here, or we can hook on the elastic. And we want to turn this tooth in this direction. Alright, to turn it in this direction, we have to pull over here and go through here. Excuse me. What we would have to do is run something off of here. We hook elastic chain and we wrap that chain around that tooth and come in over here and hook it to the bracket, but do not hook it to the arch wire, and that pulls on that and rotates the tooth back in this direction. And that's the most efficient way to rotate the teeth. If you run it, you just put something and put a tooth out here, put a tooth out, something like this, and I want to turn it this way. Then I have to hook something over here. So I hook something here, right here, hook the elastic chain, go around this tooth, and hook it back to the bracket, and it will spin it in this direction. And that's the most efficient way of using, and that's elastic force. That's actually some little chains that come down. It's a very firm chain, but they stretch that out, and you stretch the hole out like this, and pulls back, and as it pulls this around, and this tooth will turn in that direction every time. Alright, that's elastics, an elastic force too. Now here we're pulling with a rubber band from the top, and we're trying to, you see this midline is here and midline is here. So we've got a rubber band coming from here, going back, and we hook it over here on the bottom. So it's pulling the bottom in this direction, and it's pulling the top in this direction. Alright, if you pull your bottom over and the top over and line this up, and that's a midline elastic. Now you can put more force over here and less on the other side, and it will tend to, you have more force over here and less over here, and it will tend to rotate it too. So there's all sorts of ways of doing it, and you want to think about it like I didn't think about it a second ago. Alright, there's the rubber bands on the side. This side has a double and goes off to the length and off to the buckle of the tooth. And we correct class 2 problems like that. Now, this is the midline pulling across here when you open your mouth, and this is pulling from the buckle. Over on this side, we want it to move more over here, so we pull one off of the lingual. Now, I have where I've got bands on the teeth, or if I use molar bands when I do a lot of this work I put a lingual button on this side right here, and I pull on that, it tends to rotate the tooth in this direction. See, so I pull over here with twice the force I've got over here. That's moving this side around, and it's pulling this side around more, and it's having to line up the midline. You can do anything you want to with those teeth, and you don't get too old. Now, sometimes you got somebody with an extremely tight lingual button, a lingual ligament here, pulling these teeth back. If this is so tight they can't get their tongue much further than that, you've got to go in and take this ligament out. You don't just cut it in two, you go back together and do the same thing. So you take it out. Okay. So we take somebody like it is and use these forces to direct these teeth. Now we've got this banded, and when we get through with this case, we're going to have a lot of space, upper and lower, that we'll have to close all at once with nothing on them. And that's where the problem comes in with bands, as finishing up with the torque you want on the teeth. Okay. This is just part of the force that you can get out of rubber bands. Separators go in the mouth, different ways of putting the separators in. I don't know what I did then, but I keep this quiet. I'm going to keep those deals. Now, but you can figure up in your head how you can get the elastic force that you use from that and add it to the natural force that the person is doing something with. If the natural force is biting down here, then you can use that too. So I'm going to say goodbye, and I hope you pick something up. Just think about the situation, draw it out, and it'll help you understand what the force is. This is tightening together with elastics or with separators. You squeeze the plastic material that's expanding, you squeeze it, and then it pushes out and absorbs moisture and pushes out that way. And that's the same thing, same reverse of it. So I'm going to say goodbye, and I hope you got something from this, and we'll close up here. I hope you'll join our group and subscribe to it. So we'll close out. Thank you now. Bye-bye.